what that's going to look like is if someone, you guys can all come around. So if someone has limited internal rotation range of motion, okay, so just for the sake of, can you scoot down just a little bit that way? Okay, so if someone has limited internal rotation range of motion, what I'm going to do is, it's a ER contract relax, and so what I'm gonna get myself into a, I'm gonna get my arm. So this arm handhold is gonna be something you guys are gonna fumble upon, but it's okay. But you're gonna put your hand underneath the arm, and then your hand on the backside of the wrist. Then your other hand is free, so I can move her arm into internal rotation with this arm here. Then I can use my other arm here to apply a posterior mob. And the reason why I can do that is now when she pushes backwards, go ahead, I have like a strong lever arm against her, so I don't have to work very hard. And so what I'm doing here is a contract relax. And then she's going to actively try to get a little bit more internal rotation range of motion. And so typically what I do first, because we're talking about going back to those like principles that Michael talked about earlier, is we need to first get the area, the shoulder joint, just like used to the motion that we're about to be in. And so what I typically do is I sit like with a little bit of posterior mob into internal rotation near the end range, and I'll hang out here for about a minute or so, and I'm just getting that joint used to what it feels like, and to be better with my mechanics, I can actually like keep my elbow up here.
With the posterior glide, are you going to R1 or R2, or are you actually trying to get?
I'm going like basically right to R2. The reason for this is to make sure that it's not like it's not jumping up into my hand. So I'm getting more of the like posterior capsule joint force through the contract relax and internal rotation component versus through the joint mode. For her, for the purpose of her, so her internal rotation range of motion is like not super stiff like we would typically see, like we're gonna be up here, so like I can actually get my arm up here and I can do this. I'm sorry. I'm gonna actually bring her up into a little bit of a horizontal adduction to stiffen her up just a little bit, just so you guys can see like there's a stiffness, right? So that way you can feel this. And so you may see this for more active individuals. Like this is not very like for a shoulder impingement, you may have to like bring them up, and if they're feeling good here, you don't really feel that muscular restriction, I would bring them up into a little bit more of horizontal adduction. So I'm here, I'm rotating in, I'm holding, bringing up tissue tension, hanging out in this position for about a minute. Her body's getting used to that. I'm gonna have her push back into external rotation, push, and we're gonna 10-second hold. After 10 seconds, I'm gonna ask you to actively try to internally rotate in just a little bit to end range. And so the goal of this is that now you're actively trying to get more internal rotation range, so you're gonna be able to actively stabilize this after getting out of this motion. And then what you're gonna do again is you're gonna contract, go external rotation again. And you feel it's like pretty, like it's pinpoint to the external rotators, right? And then you're gonna relax and actively go into more internal rotation. And what you're gonna see is that because of that like PNF nature basically of relaxing the muscle on the backside of the shoulder, you're gonna potentially get more internal rotation range of motion because that capsule is part of the external rotation, or the external rotators are part of the capsule. All right, and then go ahead and external rotate again, and I'll do that 3 sets of 10 with 10-second contractions back and forth. Then go ahead and internal rotate. And then to come out of it, because it's new range that she didn't have quite before, I'll have her external rotate, and then I will take her out of this position and then relax. Good. And so again, kind of we're treating normal healthies, but in terms of her internal rotation range of motion, I would try that out with like some of your like impingement patients with impingement, because especially taking them, if like let's say your arm hold is like wrong, so like something I sometimes fumble with is like where this hand goes, and like sometimes like this hand's my face. If you just hold their arm, like let's say you can't get a good glide in because their arm's really long, I'll just have my hand in front of their anterior shoulder, and I'll bring them up into horizontal adduction anyway, because that closes down and it gets more of the posterior capsule anyway. Yeah. Any questions on that?